This patient is getting a spay. As such, we have positioned her in dorsal recumbency on her back to keep the surgery site clean and easily accessible, as well as keeping her steady with sandbags either side. The surgical site is clipped with a number 40 blade. At our clinic, we like to keep a nice wide field, generally cutting from the vulva up to the top of the rib cage. This allows the surgeon to extend the incision if necessary without compromising sterility. The field clipped should allow for approximately 10 centimetres either side of the incision site. Not preparing a big enough zone of exclusion can compromise the sterility of the site and increase the risk of bacteria finding a way into the surgical field. Hair can't be made sterile, so it must be clipped as close as possible, working against the grain to achieve a close shave. The area is then vacuumed to ensure no remaining hair is left on the patient or the surgery table. The area is then cleaned with a chlorhexidine scrub solution. Surgical swabs are used to clean the site from the starting point of the incision, working their way out in a spiral towards the outer field of the surgical site. It is important that all parts of the field are sterile, and once the swab grazes the dirtiest part of the patient, in this case probably the vulva, it should be thrown away and a fresh swab used. This is to prevent passing any bacteria from this area into the outer sterile field. This is generally done for 2 minutes, which has been clipped in this video, but done for 2 minutes, and by the end there should not be any visual dirt on the swab. It should look clean. It's also important to ensure the swabs are thrown away, not placed on the surgical table or towel. This creates a patch of moisture which can provide a space for bacteria to travel across and make contact with sterile drapes or kits. Once clean, the patient is then sprayed with Alcoholix chlorhexidine. This alcohol solution assists in killing bacteria, but it also helps in removing any remaining oils off of the skin. Once this is done and aseptically scrubbed away twice, an aqueous layer of chlorhexidine spray is then left sitting on the patient. It should be lightly sprayed across the site, and the solution should not be pooling or travelling across the site, as this potentially allows bacteria to travel with it. The surgeon will wipe this away with autoclaved swabs once they begin surgery in order to keep up the highest standards of sterility.